Imagine planning your entire day around avoiding pain, skipping family dinners, sitting on the sidelines while your life happens around you. Now, Maria lived like this for 10 years, David for 15, and Jonathan for over 20. And they were told surgery was inevitable. But today, they're pain-free, back to the activities they love and no longer controlled by fear of flare-ups. Now, this video will reveal the one therapy all three tried and finally worked when nothing else did. Hi, I'm Dr. Tam Lee. I'm a chiropractor here in San Jose, California. And over the past 20 years, I've treated hundreds of patients with severe sciatica, herniated discs, and chronic back pain. Now, many of them came to me after being told the same thing. Surgery is your only option. But what I've seen in my practice tells a very different story. Now, the three cases I'm about to share with you aren't rare exceptions. They're proof that when you address the root cause with the right treatment protocol, the body has an incredible ability to heal. Now, let me walk you through what happened. So, patient case number one, Maria's story. Now, the first patient I want to tell you about is Maria. Now, she came to my office after dealing with chronic low back pain for over 10 years. Now, by the time she got to me, it wasn't just her back anymore. She had this sharp shooting pain going down her right leg all the way down to her calf and her foot. Numbness and tingling, especially when she sat for any amount of time. And sitting had become something she actually dreaded. Now, her MRI showed a broad-based disc bulge, an extrusion at the L4-5 at about 2 millimeters to 6 millimeters, pressing right on the nerve root. Now, she also had severe spinal stenosis, neuroforaminal stenosis, worse from her last scan. And Maria had already been through the whole circuit: primary care, specialists, pain medications. I mean, she tried physical therapy early on, and it actually made things worse. Now, the epidural injections worked for a bit, gave her a little bit of hope, but eventually they stopped doing anything at all. Now, she was running out of things to try. Honestly, she was running out of hope. Now, here's the thing that people really don't get unless they've been through it. The pain itself wasn't even the worst part. It was how much it took over her entire life. Everything she did revolved around not triggering the pain. If she sat too long, she'd have this fear of a flare-up. She'd get anxious just thinking about having to drive somewhere, going out to eat with her friends and family. It was so stressful just to think of it. And she was sleeping maybe 3 or 4 hours at night. She was so exhausted all the time. And she stopped making plans because she had no idea how she was gonna feel that day. The anxiety about flare-ups controlled everything in her life, and she told me she felt like she was watching life go by, go around, and she was stuck. So here's what we did differently. Over 4 months, Maria came in 2 to 3 times a week for spinal decompression. We also did gentle activator and drop style chiropractic adjustments. She got physiotherapy, and I gave her home-based exercises. Now, we added shockwave therapy once a week for about 8 weeks to work on those deep tissue inflammation. Maria ended up with about 85 to 90% improvement in her pain. Her flexibility got better. She could sit and stand without the same problems. Now, the leg symptoms and the numbness went way down. But honestly, the real change wasn't just the numbers. It was getting her life back. Now she can sit through a whole meal, watch a movie, drive somewhere without being afraid of sudden pain anymore. Now, she wakes up without stiffness and without wondering how bad the day is going to be. She's not planning everything around avoiding pain anymore. She told me she actually feels present with her family now instead of being distracted by the discomfort. And her confidence came back. She trusts her body again, and she's not living with that fear that this is just how things are going to be forever. Patient case 2, David's story. Now, Maria's case was great, but the next patient had been dealing with pain even longer. David came in after 15 years of chronic lower back pain. He had left leg weakness, tingling and burning, the feeling that it would get worse whenever he tried to walk or stand. And by the time he found us, he couldn't stand or walk for more than 10 minutes before he had to sit down. Now, his MRI showed an L5 unilateral disc protrusion with foraminal stenosis and nerve root compression. Basically, the disc was pinching on the nerve and his body was letting him know about it every step. Just like Maria, David had tried everything. Acupuncture, inversion tables, traction tables at his PT office, medications. He even did a nerve ablation and nothing stuck. And same as Maria, the physical pain was only half of it. David had completely stopped exercising. No more tennis, no more pickleball. He'd put on weight. His work performance had dropped off so much he was genuinely worried about losing his job. And he felt frustrated, discouraged. Pretty hopeless, really. And the life he used to have felt like it was just slipping away. So here's what we did. David came in for 3 times a week for 12 weeks doing spinal decompression. We added shockwave therapy, class 4 laser therapy to bring down the inflammation and help with healing. He got targeted chiropractic adjustments and I showed him exercises to do, and we put him on some nutritional supplements to help the recovery along. Now, David got about 95% of his pain improved. He could stand and walk so much longer than he could before, and his spinal stability and strength came back. But again, it's not just about the percentages. Now David walks without constantly scanning for somewhere to sit or lean against something. He can stand and have full conversations at work with his friends without watching the clock. He takes his boys to jump parks and he's not sitting on the bench. His energy is better because he's actually sleeping through the night. And that hopeless feeling turned into optimism. He feels capable again, not broken and not limited. Case number 3 is Jonathan's story. So you're probably noticing a pattern here. Both Maria and David had been already going through other treatments, other therapies, and they just weren't working. Well, what we did differently was go after the root cause of their pain and the disability with non-surgical spinal decompression. Now, we're not just covering up symptoms or giving temporary relief. We're actually creating space in the spine, taking pressure off the compressed nerves, letting the body heal. That's management versus actually fixing the problem. Now, the third case might be the most compelling of all. Now, Jonathan had been dealing with chronic lumbar pain for over 20 years. 20 years, the pain went down both legs, all the way to his feet. Now, he's a retired dentist and should have been enjoying retirement, but instead, even basic stuff like sitting, standing, walking, just moving around from one position to another was excruciating. His MRI showed a severe disc herniation at L5-S1, spinal stenosis. Both nerve roots were being impinged on, and both sides were a problem. Jonathan had tried physical therapy, acupuncture, massage, lumbar traction. None of it worked. And the effect on his life was pretty devastating. Now, he had stopped traveling, stopped golfing, stopped spending real time and quality time with his family. He lived with this constant fear that, he was going to end up in a wheelchair. And it wasn't just about the pain anymore. It was about losing everything that made his life worth living bit by bit. So here's what we did. Jonathan did 3 months of intense spinal decompression, coming in 2 to 3 times a week. We did chiropractic adjustments, physiotherapy. We gave him exercises to do at home. And here's the important part. Once he got his results, we just didn't say, good luck, and send him off. He's been on maintenance care. He comes in every month or 2, and Jonathan has been my best patient for 5 years now. And he's been able to get back everything he lost and actually is keeping it. Now, Jonathan got about 80 to 85% improvement in his pain. He got back to living the life he knew was possible, but was afraid that he had lost. So his quality of life now, you ask? Well, he sleeps through the night. He travels 2 or 3 times a year without stressing about flare-ups. And he's back out there golfing with his friends on the weekends. He's fully there at family gatherings, not distracted or in pain, and he feels good about the future. And he hasn't thought about the wheelchair in years. If you've been dealing with leg pain, sciatica, or you've got an L4, L5, disc bulge, or herniation, and you've already been through physical therapy, medications, injections, all of that, and nothing's really worked, that's where non-surgical spinal decompression is worth taking a look at. Now, the results we get with patients are really good. We're taking major reductions in back and leg pain, people getting their function back, their quality of life is improving. There's solid research backing this up as an effective treatment for disc bulges and herniations that doesn't involve surgery. Find a spinal decompression doctor in your area who is well trained and has good experience with it. See if you're a candidate. Let me know in the comments how it goes for you. If this video helped, go ahead and like and share it. There are a lot of people out there with sciatica who don't even know surgery isn't their only option. Subscribe if you want more videos on protecting your spine, understanding what is going on with your condition, and learning about treatments that actually give people long-term relief. I put a new video out every week, and if you want to see more on how non-surgical spinal decompression actually works, check out this video.